How do anatomical planes relate to joint movements? Imagine your body as a well-coordinated machine, moving smoothly in different directions. To understand how these movements happen, we use imaginary flat surfaces called anatomical planes. These planes help us describe and analyze how joints move during activities like walking, lifting, or twisting. They are like invisible lines that divide the body into sections, making it easier to talk about movement. There are three main planes to remember. The first is the sagittal plane. It cuts the body into left and right halves. Movements in this plane include bending and straightening joints, like when you bend your elbow or knee. Think about walking or running. Most of that motion happens in the sagittal plane. When you do a forward lunge or sit down, your joints are moving along this plane. Next is the frontal or coronal plane. It divides the body into front and back parts. Movements here are side to side. Raising your arms out to the sides or jumping jacks happen in this plane. When you lift your leg sideways or do a side bend, your joints are moving in the frontal plane. These motions are called abduction when moving away from the middle and adduction when moving back toward it. The third plane is the transverse or horizontal plane. It cuts the body into top and bottom sections. Movements in this plane involve rotation. Turning your head side to side or twisting your torso are examples. Rotating your arm inward or outward also happens in this plane. These rotational movements happen around a vertical axis, which runs up and down through your body. Each joint movement occurs around a specific axis that is perpendicular to the plane of motion. For example, when you bend your elbow in the sagittal plane, it moves around a side-to-side axis called a frontal axis. When you lift your arm sideways in the frontal plane, it rotates around a front-to-back axis called a sagittal axis. Rotations in the transverse plane happen around a vertical axis, like when you turn your head or twist your torso. Knowing how these planes and axes relate helps us understand how muscles and joints work together. It makes it easier to describe movements clearly and accurately. Whether you're stretching, exercising, or recovering from an injury, understanding these planes helps you move better and stay balanced. When you lift your arm forward, you're moving in the sagittal plane. When you lift it to the side, you're in the frontal plane. Rotating your arm inward or outward is a transverse plane movement. Recognizing these patterns helps in designing exercises or therapies that target all types of motion, keeping your joints healthy and your movements smooth.